In today's video, we're going to talk about a checklist for parents that might suspect a visual impairment for their child. The information discussed is intended to be educational and is not intended in any way as a substitute for medical advice and/or care from their qualified vision care providers. The reader is advised to consult a vision care professional in matters relating to visual health, and particularly with respect to any symptoms that may require diagnosis or medical attention. If you check off several items on the following checklist, please take your child for a thorough visual examination. Early detection of visual problems greatly increases the chances of successful rehabilitation. Children should be examined by an eye doctor during infancy and preschool years to detect potential problems. Your child should also receive a vision exam prior to entering kindergarten and at a minimum when they also enter 6th grade. Many parents today are under the impression that the vision screening their children receive from the school nurse is sufficient. The screening at school will determine the child's distance vision, but what is missing is the near vision. Very few eye screenings include this much needed exam. Just as children should visit the pediatrician and the dentist, they should also see a licensed eye care provider to screen for vision problems. Some common pediatric visual conditions which are not detected through the 20/20 eye chart test alone are amblyopia, hyperopia, strabismus, and convergence insufficiency disorder. Convergence insufficiency disorder can also only be treated by a certified physician of vision therapy. When watching your child perform everyday activities, observe if one eye drifts or aims in different direction than the other. This is significant even if it only occurs when the child is tired or stressed. Watch to see if they turn or tilt their head while reading or doing other visual activities. Their head is frequently tilted to one side or one shoulder is noticeably higher. Notice to see if they squint or close one eye. Also observe if your child has excessive blinking or squinting, has poor visual motor coordination skills, problems judging distances while moving in space, or frequently bumps into things or drops things. Watch to see if they become easily confused when in motion or frequently lose things. Observe your child while reading or doing close work, and if they present any of these symptoms: holds the reading material or object too close, closes one eye or covers eye with hand, twists or tilts head toward book or object as to favor one eye, uses finger or ruler to read, or frequently lose their place and skip or repeat lines. While doing close work, do they fatigue easily or become drowsy? Do they rub eyes during or after periods of the reading of close work? Do they report that the words move on the page or run together? Do they have a tendency to knock things over on a desk or table or exhibit avoidance behaviors? Does your child report headaches or eye strain, nausea or dizziness, motion sickness or car sickness, or double vision? If your child reports seeing double, please take your child for a vision evaluation immediately. Remember that your child probably would not know that double vision is abnormal, and it is likely that he or she would bring up the subject. If your child is observed or report any of the behaviors that have been mentioned, please take them to a physician of optometry for further examination.